Health Disparities Due to Socioeconomic Status by Karen Last. Individuals with low income are being underserved by the healthcare community. Diversity has affected the healthcare system in modern society by expanding the cultural understanding of medical professionals to include all of the populations it serves. Healthcare inequality. Health disparities due to socioeconomic barriers have shaped the medical field. It has caused a great chasm in the quality and longevity of millions of Americans. It is important to find ways to bridge the gap in quality and accessibility to healthcare in less economically stable regions of our society. Diversity in backgrounds such as educational level, income, culture, accessibility, weather, or personal beliefs can all be reasons individually or collaboratively for not accessing healthcare. Sociology of diversity, biological diversity, cultural identity, diversity through socioeconomic status, etc. Issue. Equitable healthcare is an especially important topic because it affects the overall well-being every individual attains for the duration of their life. In the social sphere, a person is less able to work and earn money to create a better life for themselves and their families if they are sick. A person's health partially determines where the trajectory of their life will go, whether or not they can complete a term of education, and their ability to potentiate all of the dreams they have. Social change has been made to tackle the gaping hole of uninsured or underinsured with the implementation of the Affordable Care Act. Overcoming issues of diversity identified in a study on educational variations in mortality from conditions amenable to medical interventions in 16 European populations. This study showed that inequalities in mortality from these conditions are often substantial and contribute to between 11 and 24% of inequalities in partial life expectancy between the ages of 30 and 64. Strategies that can be used to correct the problem of healthcare inequalities are to first create a public health campaign to identify it as an issue within our society, using advertisement on public transportation, such as many public health campaigns have used in the past. Once people realize that accessing healthcare will improve the life expectancy of all populations, they may self-identify and take the initiative to seek a primary care doctor for an initial assessment. Data needs to be collected that identifies and assesses the population and problem of diversity in relation to health outcomes. The responsible issues need to be analyzed and identified. Then, a plan needs to be created to deal with the issue of inequitable health care. The benefit of having a local health service organization or hospital extend community outreach efforts would help residents due to the limited access to transportation that many low-income residents have. Community outreach programs to identify populations in need of care are a gateway to bring people back in to a regular health screening. Social services that offer transportation to underserved populations can be utilized for service. Conclusion. There are 6 key areas where intervention can help reduce inequalities: socioeconomic conditions, social and physical environments, access to quality health care, cultural competence, health literacy, and empowered healthcare consumers.